Hey family, this is Shannon Jackson, also known as the People's Nurse. I'm excited to have my special guest with me today, none other than Dr. Kristi Newberry, where we will be discussing in vitro in fertilization. But before we go any further, make sure you like and subscribe. Now let's dive in.
Wake up everybody, let's elevate your mind. Live your life without limits, no more wasting time. Don't forget to stay focused while continuing to stay on the grind. Keep your vision real tight, then your future be bright until the finish line.
Once again, Dr. Kristi, thank you so much for being on Living Your Life Without Limits today. I'm very excited to talk to you and dive into this important subject, such as in vitro in fertilization. But I want to ask you first, you've been in a profession for a long time. Why did you choose to specialize in this field?
Yeah, that's a great question. My desire to specialize in this field, it sort of grew over time. So as a clinical psychologist, I was already trained in the ability to diagnose and treat mental illness, right? But then a lot of my work ended up focusing on people who have what we call co-occurring health conditions. So people with chronic medical conditions, which of course, affect your mental health because, you live in a body. And so everything that's happening to your body, of course, is affecting your mind and your moods. So I had done that for about 10 years. And then my current husband and I started trying to expand our own family, and we were running into difficulty kind of unexpectedly. And honestly, I was really surprised at the lack of mental health support available for people going through any kind of assisted reproductive technologies. I was sort of floored. I thought, well, of course there's psychologists or therapists to talk to. I think anybody thinking about IVF could say, well, that might be kind of challenging, so there should be support people. And I was really alarmed to find out that there just weren't. And so I decided then I need to rectify that. And after I was through some of my own experiences, I decided to go and then get additional training so that I could be that for other people.
Wonderful. So basically, from your personal challenge, kind of led you down this path that you can bring the personal as well as the passion at the same time. Yes,
that's right.
So for our viewing and listening audience that may not know, I always like to have education around the subject, that may not know what that is. Mm-hmm. Why don't you talk to us about what IVF is, so that people can get a clearer understanding of that?
Yeah, absolutely. I do think people sometimes have a little bit of an understanding, but not much unless you're facing this road yourself. So basically, IVF, it stands for in vitro fertilization. It's a way that we can help people to conceive. And there are multiple steps. I think most people know that IVF has something to do with an egg and a sperm, and your doctor puts those two together. But it's actually a lot more involved than that. So in a typical IVF process, there are actually what we consider to be two rounds or two kind of parts of a cycle. And the first part is actually when a woman takes lots of different kinds of medications. And this is called the stimulation phase, where we're giving a woman medications, mostly injectable medications, but also they could be pills that you take, patches you wear, things like that as well. And the goal of a stimulation cycle is to help the woman grow as many eggs as possible so that then your doctor can later retrieve those eggs during what we call an egg retrieval. Because when you think about it, every month, before menopause at least, you are growing a few eggs, and it's kind of like the leader of the pack wins, and that's the egg that gets released when you ovulate. But during IVF, what we want to do is help your body to create as many eggs as possible so that you can mature those, and your doctor will kind of pause ovulation to the right time, and then we'll go in through surgery actually and retrieve those eggs while you're under general anesthesia. So it is an involved process, that part, and it is invasive. The second half of an IVF cycle is what we call a transfer, and that's when your doctor has taken those eggs, or really the embryologist actually has taken those eggs and then has combined them with sperm. And nowadays, the way we do that typically is actually the embryologist looks for sperm that seem to be the most healthy, and they pick them individually, and they actually put that sperm right into the egg. So it's very detailed and exact. They let those grow for about 5 to 7 days to the point that they become embryos. And once they're an embryo, then they're kind of ready to be put back into the uterus. And that's what we would call an embryo transfer. And most of the time, women take medications leading up to that transfer as well. So sometimes an egg retrieval will happen, and then a transfer could happen right after that, within a couple weeks. That would be called a fresh transfer. And other times we do what's called a frozen transfer, where you do the egg retrieval and then you maybe wait a couple of months. The embryos are grown, but then they're frozen, and then you would go back later and then you would do a transfer with a frozen embryo that's thawed.
It's amazing how technology has advanced this process from when it first was introduced back in the day. And now I do know that thank you for that thorough explanation, but I do know that sometimes there's even challenges with that where, you know, people are hopeful and they still aren't able to conceive, you know.
Yeah,
so
absolutely.
How, from the psychological perspective on this, and one of the reasons why I wanted to bring this in, there's many couples and many women, if they can't bear children in cultures and just different, it affects not only their relationships, their family units, their value systems, and sometimes it causes an extreme emotional trauma to them. Because of the fact that having a child or having a firstborn son or whatever the culture may lend itself to, but being barren is considered such a negative image for women. So when they get broken like this, it can really shatter the spirit for years and create a lot of issues. How do you handle that? What can be said to, maybe some people are watching or looking and struggling. I've known people through years that have struggled, some successful and some unsuccessful, and it can be very, very painful in the process. What do you say to people that come to you in this place? What advice would you give?
Gosh, you're so right to talk about it that way. IVF is not a cure, and going down that path, it's not a guarantee. And we might talk about some of my own history with that later, but you know, I think even myself, I naively thought when I was starting down this road that, we're doing the hardest thing, so surely it'll work, right? And that's not how it goes for most women. And I do think our ability to conceive and bear children for most women in all kinds of different cultures, it's really wrapped up in our identity. And so it feels like when you can't do this, the most basic thing that really I think a lot of us believe we should be able to do, right? Like we were designed to do this and we can't. It feels like such a failing. And it is, you're right, it's such a deep wound that people face. And they have to work through that, even if they are successful down the road and they end up becoming a parent in one way or another. There are multiple paths to parenthood. That's what I always tell my patients. That doesn't necessarily take away the trauma that they've experienced. So when I think about what can we do to help women and help couples who are facing that, honestly, one of the first things has less to do, I think, with doing and more to do with listening, because I found at least that many women feel so isolated and alone in this process, and there's so much shame wrapped up in it, right? Because you feel like your body is failing you in this really kind of deep, primitive, and even spiritual way. And so a lot of times women don't feel like they have safe places to talk about that. And even when they do, people don't know how to respond, right? People already have a really hard time knowing how to respond when people are in pain. It's just, and it's not their fault. It's just, I think, our natural human inclination. When you are witnessing pain, people usually want to do one of two things. They either want to run away, because sometimes we feel like their pain is going to contaminate us or something, or we want to save them. And you can't save someone going through something like this. There isn't an immediate relief or an immediate fix for them. And so I think when we talk to our friends, or you even talk to family, they don't know what to say. They don't know how to handle it. So women end up feeling extremely isolated. And then if they do find someone to talk to, like a mental health professional, or maybe a trusted faith advisor, they sometimes feel like they're having to then re-educate that person, and that's just exhausting. It's exhausting for them to do that because they're already going through so much, and the last thing they want to do is sit down with a therapist or sit down with a minister and explain it to them so that they can even kind of catch up to the point of being able to help. So really, I think the first step towards healing when you're talking about this kind of trauma is just to be a place where they can say what they need to say, and you listen. You listen without judgment, and you listen with an understanding of what they're going through as someone who's already an expert, so they don't have to worry that maybe you don't understand what they're saying or that you don't understand the process. So I think listening is huge. And I do think there's something inherently healing about having, the way I think of it is like having a witness to your trauma. There's something about that sort of helps people not only feel less alone, but feel validated. Because I think we bring all of these ideas in our mind about how we should be feeling and we should be acting. And having someone witness your trauma and say, no, that is astoundingly hard. Just that, as simple as that is, that's so healing for people, because we tend to doubt, or we think, why am I taking this so hard? Or they don't have language to process the loss because it's not always tangible. And so I think by really just listening and providing that safe space, that alone can be so healing.
Yes, it can be. And just active listening and being engaged and present does a world of good. Sometimes people don't want you to fix their problems. They just want you to hear them. Hear them and be engaged and be present at the moment. So I agree with that. So in this process, do you find it very more couples coming in, or is it more women, or is it sometimes a struggle in between? Because sometimes it can bring relationships together, and sometimes it can cause severing of ties, and I've seen it on both ends. So I just want to back up for a moment. So let's start just a little bit. Say a woman or a couple is desiring to have children, and they're just trying on their own, and they're doing that. When do you advise, or do you recommend or suggest when they consider the process of going through IVG?
Yeah, of course.
IVF, not IVG. IVF,
yeah, of course. So typically the guidance is that if you're under 35, you should be actively trying for a year before you consider anything kind of extra to help you out. Okay. After 35, women's ability to conceive starts to take kind of a downward, it declines, and sometimes that decline can be pretty rapidly, unfortunately. And I never say that to scare people. I certainly don't want women over 35 to be panicking, but at the same time, I think it's important that they're informed. And after 35, between about 35 and 40, it's actually a pretty short window of time where we see that egg quality in particular really goes down. And for some women, it's kind of this slow, steady decline. And for other women, it kind of plugs along and then drops. The issue is you never can predict when that's going to happen. So typically we say if you're over the age of 35 and you've been actively trying for 6 months and you're still not pregnant, then you should seek help from a specialist.
That's very helpful information for people. because one of the things that's happening, more people are into their careers now, and they're actually having families later in life. Unlike in my generation, we did it the reverse. We were, trying to struggle and do both at the same time. And don't talk about the generation before my generation, right? And so it's very helpful on that aspect of it. Also, I wanted to ask you about the people that are in that area. Oftentimes, are they recommending that they freeze their eggs if they're not ready? At least they'll have some healthy eggs that they can pause on until that point when they're ready. Is that part of the process if people are still unsure?
Yeah, it definitely can be part of the process. I sort of joke around with my patients, and I work at a university as well. And there are times when I'll say to some of my friends, I wish I could take all of my university students and tell them, freeze your eggs. I probably can't do that. I would probably get in trouble, and I don't, but I think it all the time. Yeah, exactly. So there are some situations where doctors do talk to women more about freezing eggs, particularly if they're going through any kind of cancer treatments or they're about to go through cancer treatments. Thankfully, that now has become part of the regular conversation, which I think is really important. Sometimes we talk about egg freezing as part of IVF, but usually by the time a couple is sitting down with a specialist, they're kind of past the point of just freezing eggs, because really they usually are feeling a little bit under a time crunch at that point, and it's getting the eggs that's the most invasive part of the process. So really, it's kind of like if you're willing to go through an egg retrieval, you've sort of done some of the hardest part of IVF already, and I think that is something that can hold people back. It's that fear of going through something a little bit more invasive. So if someone's willing to do an egg retrieval, they've really, in some ways, they've done medically the harder part of IVF. I would say that's not the emotionally harder part. But,
exactly.
Yeah.
Now, are a lot of insurances on board with this, or is it still half and half, or is it still a struggle and many people have to pay out of pocket? Because that could be another thing that people desire and they don't have the money. And I know, the insurance game keeps evolving. I can't even keep up anymore who's paying and who's not, right? What's considered valid. What are you finding in your practice in particular?
Oh my goodness. I could probably talk about this for an hour. It's so frustrating. So unfortunately, every state is different with insurance.
Sure,
there are a handful of states that now require IVF treatments to be covered. I'm really fortunate to live in a state where that's the case. There are lots of states still, a majority of states.
And what state is that? Because we have people all over there.
In Illinois. So Illinois requires insurance companies to provide coverage for IVF.
Excellent.
Now, a majority of states do not require fertility treatments to be covered. And even though your insurance might cover the treatment, like quote unquote cover, right? That definitely doesn't mean that there's not sometimes a significant cost that goes along with that. And then to make it even more complicated, each insurance company kind of sets its own rules around what you need to do to prove that you need IVF. So for example, some insurance companies might say, well, you need to, for example, do 3 or 4 IUIs. An IUI is an intrauterine insemination. It's less invasive. It's basically where you take medication. You would take your partner's sperm or donor sperm, and that would be like kind of placed in you. It's much less invasive, but it's also much less successful. And so your insurance company might decide, well, you need to do that so many times first. Or, and this is horrible, some insurance companies even decide that you need to experience a certain amount of losses, a certain amount of miscarriages before they'll clear you for something like IVF, which blows my mind. I think that completely really, inappropriate. Yeah, it's horrible.
Definitely from a mental perspective, I'm losing, and I know people that have had like 4 or 5 miscarriages, you know what I mean?
Yes.
Not intending to meet the insurance obligation, but just the fact that they just hold
Of course not, especially when there's technology that could help with that. So one of the newer pieces of technology is called PGS or PGT testing, where if you've gone through IVF, they can actually test just a couple of cells from that embryo. They're actually testing cells from what becomes the placenta later on. So they're not touching cells that make a baby, but they can actually test those cells for chromosomal abnormalities. And chromosomal abnormalities are the number one cause of miscarriage when women are over 35. So we have technology that could help if someone was experiencing recurring miscarriages, but insurance doesn't cover that at all in most cases. So it is costly. We did have insurance coverage, but to be very honest with you, we went through several rounds of IVF and it still cost us about $15,000 out of pocket. And that was with insurance coverage. So it's a huge barrier to treatment, huge barrier. And I've seen couples and women do all kinds of things to help. Some of them will fundraise. There are a few grants available if you connect with not-for-profit organizations. And actually Starbucks is famous for this because if you work at Starbucks half-time, you get insurance benefits, which include IVF coverage. So there's a whole group of women out there that go to be baristas just so they can get fertility benefits.
I did not know that. That is very good for Starbucks, you know.
I know.
I mean, quality of life and health and people finding things to bring that joy is so important. And it's wonderful when you see big corporations step up in the area of health and wellness and education, providing added benefits to the package that can offer people to have a more balanced and healthier life. So I'm very impressed to see that. I drink Starbucks all the time, so I'll continue.
I was going to say, so enjoy your latte.
Exactly. So I want to move before we go on. I know you have a personal connection to this, as you had mentioned earlier. Do you mind sharing a little bit of that before we go into our final question? Okay.
I don't mind
at
all.
So you can
I'm
encourage other people about this. I know you have a personal journey with this experience. Talk to us a little bit about it.
Sure. Yeah. I really am an open book when it comes to this. And I tell that to all of my patients who come to me for IVF related treatments, because I think there's something special when you can hold hope for people who are feeling hopeless. And I think sharing your story is a way that we can do that. And it helps to take away the shame that we talked about earlier. So I kind of love, and every chance I get to share, I'm happy to do so. So like I said, my, well, let me back up a minute. It's actually, I think it's sort of ironic. I have an older child who's 15, and I got pregnant with him very easily in graduate school. And so I never anticipated having any problems conceiving. Now, obviously, that was a long time ago, but I just really thought, okay, so whenever I want to get pregnant again, I will. I never gave it a second thought. But then I got remarried. My husband didn't have any biological children of his own, and we really wanted to expand our family. And so, of course, we started trying. And I'm a very, as you might guess, I'm a very type A kind of personality. So I did all the things, right? I was tracking everything. I was tracking my ovulation, counting days. I mean, anything you could do on your own, I was doing all of it. And we did that for 6 months and nothing. And I just thought, this doesn't seem right. I had kind of an internal sense that something was going on. So I went to my gynecologist, and she ran some simple blood work. Everything looked fine. And she prescribed to me a medication that was supposed to help me ovulate more strongly. And I thought, well, I know I'm ovulating already, so why aren't we trying to figure out what's causing the problem? So right away, I just went to a fertility specialist instead of doing what my gynecologist suggested, because it just felt like, okay, we're not addressing the problem, and I'm not going to waste my time taking a medication I don't need to take. So we went straight to a reproductive endocrinologist and RE. That's who you would see for IVF. And they laid out all the options for us, which included taking medications, doing an IUI, like I'd mentioned earlier, or IVF. And each one has a higher success rate. Kind of the more invasive you go, the higher the chances of success. But even doing IVF, it's not anywhere near 90 to 100% guaranteed that you'll come away with a baby. So we decided for us that we just wanted to jump right in. At that time, my husband was already in his 40s, and we just didn't really feel like we had a lot of time to wait 6 months and see if this works before we move on to something else. So we jumped right into IVF. I responded well to the medications, but our embryos kind of would fall apart. So we weren't having the success that the doctors thought we would have, and they didn't have a good reason for why. They didn't know what was going on, and they didn't give us very good answers about what was wrong. I hadn't really been diagnosed with anything, and on paper, everything looked good. So we were with one clinic in Chicago for 2 rounds. So that means 2 egg retrievals and 2 transfers. My second transfer ended in an early loss. And at that time, I had started doing my own research and had come to my doctor, and I actually suggested a different medication protocol that I thought would be better suited for my body. And he wasn't open to that. So we left that clinic because I just felt like, why are we going to keep trying the same thing? It's obviously not working. So we went to a different clinic, one that was highly recommended in the area. I hit up all of my social media IVF friends at that time and said, who do you recommend? Who should I go to? And we ended at the clinic that now we're still with, and we love them. And the doctor was so great. She's wonderful. She thinks outside of the box. And she heard me when I said, I've looked into this other medication protocol. I think it would be better suited based on the problems I'm having. And she totally agreed with me, which was great. And she let me try that. And we did 2 more egg retrievals there. So it was a lot of surgeries for me. Our third transfer ended in a miscarriage, which I have to say is just one of the most devastating losses that we've been through. And then our 4th transfer was successful, and we had twins who are now 10 and a half months old, boy-girl twins.
Congratulations.
Yes, thank you. They're wonderful.
So fraternal twins.
Yeah,
yes,
fraternal
boy
twins.
And girl. Oh,
a boy and girl, and
goodness.
they are so different from each other. Yeah, so
But
it's it was a long journey.
4 attempts. I was going to ask that question, so you already answered it. 4 attempts.
Yeah, 4 attempts and 4 egg retrievals is a lot because, well, what we hope
just on the body and the emotions, and not just
So
the physical,
much.
but the psychological. That was a lot.
Absolutely, yeah. Absolutely.
So, as we're going to a close, which I thank you for sharing your beautiful story and being very candid about it, the struggle, as well as the success at the end of those beautiful twins that you have. As we're going to a close, if you were to be speaking right now on this subject, your final thought as we're ending this beautiful episode, to say something to encourage couples and women that are struggling or contemplating, are concerned because they're aging, or have had challenges in there, what would you want to say to our viewer and listening audience? What would be the last thing you want them to take away from this very important subject? Because I do consider it very important, because I know many people are struggling with this.
So many. It is. It's so many people. 1 in 8 couples in the United States struggle with infertility. So more than likely, this affects many people that we just don't talk about it. Yes. I feel like I have so many things I want to say. I would say to anyone going through anything related to this, maybe it's just on their minds because they're aging, maybe they're struggling to conceive, maybe they're in the thick of the process. I guess I would say a couple things, actually. One is to continue holding on to hope however you can. I think there are times where you really have to just hang on to it with your fingernails almost. And if you can't do that yourself, find someone who can hold that hope for you. I think it's really important. Even if you don't feel it, find a way to just hang on to that. I think it's so important for your mental health and for your spiritual well-being to not lose sight of that. And the other thing that I would say is that there are multiple paths to parenthood. And if someone really wants to be a parent, I do believe that there's a way to make that happen. And hold open in your mind what the outcome might look like. If there's anything I've learned from IVF, working with patients and myself, it's that it's very unpredictable. And I cannot tell you the number of times I said, I didn't know that could happen. There's so many times where you face one thing after another that you weren't expecting. And I think it's really important to hold your expectations and that desired outcome kind of loosely. You know what your goal is, but you might get there in a way you didn't expect. And maybe it takes you longer than you thought, or maybe you end up doing something like using donor eggs or embryos. There's something called embryo adoption. Or, I've got friends who are in the middle of IVF and something got canceled and then they got unexpectedly pregnant on their own. And then I've known couples who...
I've seen that happen. I've seen that happen.
Yes.
I've definitely seen that happen.
I have a friend right now that just happened to her. And then, of course, there's couples who go on to adopt through traditional means, which is also so beautiful and important. So I just think if it's on your heart to be a parent, trust that that will happen, and be open to the way that that will happen for you.
Wonderful. Well said. So if anybody wanted to reach you and just reach out, I think you do not just in your state, but you do calls through Zoom or various ways. Tell us how we can reach out to you.
Yeah. So there's a couple ways. You can find me on Instagram at Dr. Kristi Newberry. You can also go to our practice website, and that's sironacenterillinois.com. And that would probably be the easiest way. But yeah, I'm all over social media.
All right, very good. Well, once again, thank you so much, Dr. Kristi, for your time and your passion. I really felt your passion on this subject, which was exciting to me. I love to interview guests that are in the thick of it. I like the word you said there, in the thick of their profession. And it's not just from their expertise, but their passion about it. And I can see that this rings true for you. And to our viewer and listening audience, those of you that may be, as she said, in the thick of it or contemplating, always know there is hope. Don't be discouraged if something hasn't happened right away. Seek out and explore all the various options that Dr. Kristi had named for you to become a parent. And if you really want it, it is there for you, because so many children, even adopted children, are looking for loving homes to call home for themselves. So that is it for us today. And I thank you, the viewer and listening audience, for tuning in to us each week for information that brings education, motivation, and inspiration. And as I often end, family, remember to love yourself. Take care of yourself. Because guess what? You are absolutely worth it. Thank you for tuning in, and we'll see you next week.